Hey, it's Jay. Today I'm going to be talking about diabetes mellitus, which is a disease of chronically elevated blood glucose or blood sugar. Over time, if blood glucose remains too high, this can lead to complications like heart attack and stroke, kidney damage, blindness, and damage to nerves all over our body. This disease affects a huge number of Americans. The American Diabetes Association estimates that over 11% of the population is suffering from complications related to this disease. The biggest impact is on individual quality of life, but there is also a huge economic cost, and estimates are a cost of over $400 billion in 2022. By the end of this video, I hope you'll understand enough about diabetes mellitus to be able to explain to your friends how the disease develops and the rationale for current and future treatments. Healthy people maintain blood glucose homeostasis, which means they maintain blood sugar levels within a normal range. That range is about 70 to 100 milligrams per deciliter, and that's in the fasted state when we haven't eaten. If blood glucose levels stay too high over a long period of time, the extra glucose molecules will attach themselves to proteins, and that is going to change the protein structure and function. This is what leads to tissue and organ damage that can eventually result in death. We need to maintain steady levels of blood glucose when we're fasting, but it's normal for glucose levels to climb after we eat a meal. For us to return to homeostasis, we need a negative feedback loop that's going to lower blood glucose after a meal, and this drop should be caused by the hormone insulin. Any negative feedback loop has three components: a sensor, a control center, and an effector. We know the starting point for this feedback loop is going to be an increase in blood glucose, so the response better be a drop in blood glucose. The sensor and control center in this feedback loop are in the pancreas, and they're the pancreatic beta cells. As blood glucose rises, more glucose enters the beta cells because those cells always have glucose transporters in their plasma membrane. The increased glucose entry into the beta cells causes those cells to release insulin into the bloodstream. The insulin travels through the bloodstream and binds to receptors in the target tissue, which includes the liver, skeletal muscle, and fat. The insulin signal causes cells in that tissue to increase glucose uptake. As glucose enters that tissue, it leaves the blood, which results in the drop in blood glucose. Diabetes mellitus is a disease where this feedback loop is disrupted, which means we lose our ability to lower blood glucose after it rises above its normal range. There are actually two types of diabetes mellitus, type 1 and type 2. We'll start talking about type 1. Type 1 diabetes mellitus is an autoimmune disease. Our immune system attacks our pancreatic beta cells, so we lose the sensor and control center in this feedback loop. We also lose the ability to produce insulin. As soon as this happens, there's no signal to the effector tissue, and we lose the ability to lower blood glucose. If we want to stay alive, we have to restore this feedback loop. The way we do this is replace the sensor with a glucose meter that you can buy at the drugstore. We can measure glucose in the blood and interpret that change in our brains. If we determine that blood glucose levels are too high, we can then inject insulin that we purchased at the drugstore. The insulin travels to the target tissue, which should behave as it normally would in response to insulin, and this will restore normal levels of blood glucose. Type 2 diabetes mellitus is different in that the beta cells are there and work as they should, at least to start. After blood glucose rises, the beta cells respond by releasing insulin, which travels through the bloodstream to the target tissue. The problem is that the target tissue doesn't respond as you would expect. The signals from the insulin receptor are turned down. This is because there are either fewer insulin receptors present, or the enzymes that should be turned on by the insulin receptor don't behave as you would expect. This is a condition called insulin resistance, and as the target tissue becomes insulin resistant, we lose our ability to lower blood glucose, so glucose levels remain elevated. There are a lot of things that play a role in the development of insulin resistance, including genetics, and the process isn't completely understood. But a major contributing factor is feedback inhibition on the insulin receptor. If insulin receptor signaling stays high over long periods of time, the products of that receptor signaling, like stored fat, are going to feed back on enzymes in the pathway to turn down signals from the insulin receptor. The cell is effectively saying to the insulin receptor, hey, we heard you, we did what you asked, stop talking to us. So even though insulin levels in the blood can be high, the target tissue isn't responding by taking in blood glucose. The best way to deal with this situation would be to restore insulin sensitivity, which could be done by relieving feedback inhibition in the target tissue. So lifestyle changes like a healthy diet and exercise can help relieve that feedback inhibition and restore insulin sensitivity, at least to an extent. It's still going to be necessary to monitor the situation with medical professionals and often use medications to make sure blood glucose stays within the normal range and avoid the long-term complications from elevated blood glucose. All right, let's go with a summary. Diabetes mellitus is a disease of elevated blood glucose, and it's caused by disruptions in the insulin feedback loop. There are two types. Type 1 diabetes mellitus is caused by an autoimmune attack on beta cells in the pancreas. With missing beta cells, we lose the sensor and control center in the insulin feedback loop, along with the signal to the effector tissue. The only treatment is to replace those components. The sensor becomes a glucose meter from the drugstore. The control center is our brain, and we get insulin that we can inject to send to the target tissue when it's necessary. Type 2 diabetes mellitus is a disease that has its roots at the target tissue, which becomes resistant to insulin signaling. Even though insulin can circulate in the blood, the target tissue doesn't respond by taking in blood glucose. The best treatment is to restore insulin sensitivity. That can be done through lifestyle changes like a healthy diet and exercise to relieve the feedback inhibition on the insulin receptor. Even then, this condition needs to be monitored in a medical setting to make sure elevated glucose levels don't cause long-term health consequences.